So good day everyone. We'll talk about Helen Erickson about modeling and role modeling theory of nursing. But first, we need to know the biography of Helen Erickson. Helen Lorraine Cook was born in 1936. Helen Erickson graduated from the Saginaw General Hospital of Nursing with a diploma in 1957, and in the same year, she married to Lance Erickson. Helen Erickson received her Bachelor of Science in Nursing from the University of Michigan in 1974. She completed her master's degree in 1976, and in 1984, she earned her PhD in Educational Psychology from the University of Michigan. She worked in the emergency room as a medical surgical nurse and as a staff nurse at the Health Science Center. She also worked in a research team that studied the effects of nursing models on the well-being of patients with Mary Ann Swain and Evelyn Tomlin. Their book, Modeling and Role Modeling, A Theory of and Paradigm for Nurses, was published in 1983. She taught holistic nursing at the University of Michigan as well as the University of South Carolina and the University of Texas at Austin. She retired in 1997 from the University of Texas at Austin. In 2012, the American Holistic Nurses Association presented Dr. Erickson with the Holistic Nurse of the Year. She was awarded Professor Emeritus and now spends her time writing and supporting nursing research.
Now for the meta paradigms. Person. Human beings are holistic persons with interacting subsystems such as biophysical, psychological, social, and cognitive, and inherent genetic basis and spiritual drive. Now for the environment. Environment is not identified in the theory as an entity of its own. The interaction between self and others, both cultural and individual. Internal and external stressors, and sources for adapting to stressors. Next up, we have health. Health is a state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. It connotates a state of dynamic equilibrium among the various subsystems. Lastly, we have nursing. The nurse-client relationship is an interactive and interpersonal process that aids the individual to identify, mobilize, and develop his or her own strengths. In the process of assisting client to achieve holistic health, the nurse must nurture the client, facilitate and accept the client unconditionally.
The overview of the theory. The modeling and role modeling theory enables nurses to care for and nurture each client with an awareness of and respect for the individual's uniqueness, which exemplifies theory-based clinical practice that focuses on the client's needs. In modeling, it is to gain an understanding of the client's world from the client's perspective. It is to build a model of the client's worldview. It recognizes that each person has a uniqueness perspective of his or her world. The nurse uses this process to develop an image and understanding of the client's world from the client's perspective. And in role modeling, the process by which the nurse facilitates and nurtures the individual in attaining, maintaining, and promoting health. It's plan and implement interventions that meet the client's perceived needs to grow, develop, and heal. According to this concept, the client is the expert in his or her own care and knows best how he or she needs to be helped.
Theoretical sources. The concepts of this theory were drawn from the work of Maslow's theory of hierarchy of needs, Erickson's theory of psychosocial stages, Piaget's theory of cognitive development, General Adaptation Syndrome or GAS by Sallier and Lazarus. The major concepts of this theory are the commonalities and differences. Erickson, Tomlin, and Swain believe that although people are alike because of their holism, lifetime growth, and development, they are also different because of inherent endowment, adaptation, and self-care knowledge. Commonalities. People are alike because of their holism, basic needs, affiliated individuation, attachment and loss, psychosocial stages and cognitive stages, or lifetime growth and development. Differences. People are different because of their inherent endowment, adaptation potential, stress, self-care, which also includes self-care knowledge, self-care resources, and self-care action.